So, what are the different types of breast cancer surgeries that you often perform?
Yeah, so, broadly speaking, there's two main types of breast surgery. One is what we call a lumpectomy, and the other is a mastectomy. Now, there's different sort of subtypes or variations of lumpectomy and mastectomy. I can go over some of the examples. Let's start with lumpectomy. So, lumpectomy is also known as a partial mastectomy. So, part of the breast tissue is being removed, not all of it. So it's a breast conserving therapy approach. And we aim to remove the tumor, whether it's breast cancer, whether it's invasive ductal or lobular, or if it's DCIS, sort of the pre-cancer. So we aim to remove the area of disease, but preserve the rest of the breast. And, we want to preserve the shape and cosmesis of the breast while getting out, the disease with clear margins. And then typically that's followed with radiation, since we're not removing all the breast tissue. So that's, lumpectomy broadly speaking. Now there's different types of lumpectomy, especially, when we talk about oncoplastics. So oncoplastics really is a principle of surgery whereby, we try to remove the disease while still maintaining the cosmesis of the breast. So one of the simpler ways of thinking about oncoplastic lumpectomy is if I'm removing an area of tissue, well, what are we going to do in order to fill in that hole, so to speak? So sometimes we bring patient's own tissue, we swing it around to maintain the shape and cosmesis. So you've got variations of lumpectomies, but the principle is to remove part of the breast tissue. Whereas a mastectomy is removing all the breast tissue. And then with a mastectomy, you have simple mastectomies where we remove all the breast tissue and not do any reconstruction. So that's removing the breast tissue along with the overlying skin and the nipple areolar complex. Other types of mastectomies that typically are accompanied with immediate reconstruction would be skin sparing or nipple sparing mastectomy. And the skin sparing is when we preserve, what I call the skin envelope that holds the breast tissue, but we remove the breast tissue with the nipple areolar complex. And then that skin envelope is filled, with either an implant-based or autologous your own tissue. So that's still, under the umbrella of mastectomy, but that enables us to preserve the skin envelope to allow for immediate reconstruction. The other type of common mastectomy we do is the nipple sparing mastectomy. And so we're preserving the skin envelope with the patient's own nipple, and then we're removing all the breast tissue.